Understanding zoonotic risks to stay safe. Before we can understand what zoonotic risks are, we need to understand what zoonoses are and why they occur. Zoonoses are a particular type of infectious disease that can affect animals and humans. They can be caused by bacteria, viruses, parasites, or even prions, such as the one responsible for mad cow disease. Zoonoses can be transmitted from animals to animals of the same species. Or they can be transmitted from animals to animals of different species. But more importantly, zoonoses can be transmitted from animals to humans and from humans to animals. Some zoonoses are well known and some are unknown and are yet to emerge. Some known zoonoses haven't been seen for a while but re-emerge under certain circumstances or re-emerge in new susceptible species. So what exactly are zoonoses? Zoonoses are infectious diseases that can be transmitted between animals and humans. How do new zoonoses or old ones emerge? Infectious diseases that are unknown to us circulate in wildlife populations. On occasion, these diseases spill over to susceptible domestic animals and/or humans, either directly or indirectly. In some instances, these diseases become established in domestic animals through amplification. This is when viruses or bacteria multiply rapidly and are transmitted quickly to more animals of the same species or different species. Humans can then become infected via contact with domestic animals. We know this process can take place, but it is often difficult to predict when it will occur. Hence, the emergence of a new zoonosis can be unpredictable. New and old zoonoses can emerge unpredictably when animal diseases spill over into humans. Why do new zoonoses emerge or old ones re-emerge? The emergence or re-emergence of zoonoses is driven by numerous factors that increase the frequency of interactions between wildlife, domestic animals, and humans. The non-exhaustive list of these factors include climate change, pollution, consumer behavior, livestock production system and market chains, industrialization, urbanization, overuse of antibiotics, land clearing, wildlife-animal habitat fragmentation, and international trade and travel. Old and new zoonoses emerge because human activities increase interactions between wildlife, domestic animals and humans, increasing the likelihood of transmission of infectious diseases between species. So how are zoonoses transmitted to humans? Zoonoses can be transmitted to humans via different pathways. Zoonoses can be airborne, transmitted from animals to humans via vectors such as mosquitoes and ticks, can be foodborne, or pass on to humans who spend time in close proximity or have direct contact with animals. Zoonoses are transmitted to humans via direct or indirect contact with animals or their byproducts. Can zoonoses be transmitted from human to human? In some cases, humans infected with a zoonosis are what we call epidemiological dead ends, and transmission of the disease doesn't go any further. Humans with zoonoses can be the source of limited transmission of zoonotic diseases to other humans. The worst-case scenario is when the disease becomes adapted to the human species and starts disseminating from human to human on a large scale, which can lead to a pandemic event. In short, if you are exposed to a zoonotic disease and become infected, you could be a source of infection to others at work and the community at large, including your family and friends. So, by protecting yourself from zoonotic risks, you also protect others in the community. Can zoonoses be transmitted from human to human? The answer is yes, which means that zoonoses are as much a biosecurity issue as they are a public health problem. Can zoonoses make you sick? If you become infected with a zoonosis, you may be mildly sick with a rash or feel really unwell. You may be left with long-lasting symptoms that may affect how you work and how you live your life. Or, in more dramatic cases, it may lead to death. For known zoonoses, there may be a medical treatment available to help you recover. However, with newly emerging zoonoses, it is less likely that a treatment will be available, and your prognosis will be much more uncertain. Zoonoses can make you mildly or severely sick, and medical treatment is not always available, so it is best to prevent becoming infected in the first place. Why should you know more about zoonoses? Well, almost 2/3 of existing and known human infectious diseases are zoonoses. These zoonoses are usually well known and the risk they represent to human health well understood. But it is also estimated that 3/4 of emerging infectious diseases affecting humans are zoonotic in nature and initially represent an unknown risk to human health. This means that people working or interacting with animals are at risk of becoming infected with a zoonosis at some point in their life. Zoonoses that are well known in known susceptible species usually present a known risk that may be recognizable and manageable. However, if a known zoonosis was to, for example, re-emerge in a newly susceptible animal species, the risk may not be as recognizable, leaving you and others vulnerable to the new zoonotic risk. Same goes for as yet unknown emerging zoonoses, which present an unknown and unpredictable risk. Remember, the less we know about a zoonosis, the more unpredictable the risk is. Therefore, it is best to assume some zoonotic risks are present at all times and to protect yourself to stay safe. Additionally, and more importantly for you, horses can also transmit zoonoses to humans. There are many references in the literature that document existing zoonotic risks linked to horses. In Australia, there are a number of known zoonoses that can be transmitted from horses to humans. While some are more common, others have the potential to become an issue for people working with horses. And of course, we have to consider the risk from zoonoses that have not yet emerged. Equine zoonoses can be transmitted via direct contact with horses, via contact with urine, feces, manure, and other bodily or airborne fluids. In your line of work, it is unlikely that you can avoid coming into contact with the horses and potentially contaminated materials. You should inform yourselves about zoonoses because the majority of infectious diseases have an animal origin, including horses. Why should you be concerned about equine zoonoses? Aside from the obvious reason being that you work with horses, you need to understand how new equine zoonoses may emerge. For this, we need to look at how humans interact with horses, which is different from how humans interact with other types of animals. Pets, such as cats and dogs, mostly live in the human environment and come in frequent contact with humans. However, these animals do not often come into contact with wildlife or livestock. Here, the overlap between humans, domestic and wildlife animals is not ideal for the emergence of a zoonosis to occur. Humans interact with livestock regularly, but most of these animals live out in the field. On occasion, these animals may come in contact with wildlife. The potential for a zoonosis to emerge is greater in this scenario than the previous one. With horses, it's a very different story, because the human-horse relationship is very much at the crossroads between the relationship humans have with pets and livestock. Horses don't live in people's houses, but humans tend to get as close to their horses as they would with their pets. Horses also live or spend long periods of time in the field where they can come in contact with wildlife carrying zoonoses. Here, the overlap is ideal for new zoonoses to emerge. Hence, humans interacting with horses are at a higher risk of being exposed to a new emerging zoonosis and should be cautious about potential zoonotic risks. A good example of this kind of zoonotic risk emerging through contact with horses is the emergence of Hendra virus in 1994. Hendra virus had probably been circulating in bat colonies for a while when it spilled over into horses and from horses to humans, with in some cases very dire consequences. To date, 4 people have died of Hendra virus. All of them had closely cared for horses without having taken proper precautions. Why should you be more concerned about equine zoonoses? Because zoonoses are more likely to emerge through horses, putting you at risk of becoming infected. And why should you protect yourself from zoonoses? Zoonoses present a biosecurity risk as they can be transmitted from humans back to animals in your care. Because zoonoses can be transmitted from human to human, they are also a workplace health and safety issue for you, your colleagues, and your clients. Finally, and we often forget about this aspect, is that people working with animals can be a source of zoonoses for others in the community and become the source of a public health problem. You should endeavour to protect yourself from zoonoses in your workplace, as you will also protect your colleagues, clients, but also your equine patients. How can you protect yourself and others from zoonoses? The interviews done within the thoroughbred industry in the region in 2018 cemented the idea that prevention yields the biggest success. In other words, you can protect yourself and others from zoonotic risks by following the general principles guiding infection control and prevention practices and personal biosecurity recommendations. There are 5 levels of control, starting with the most effective approach, which is removing the risk. This might be difficult as the source of the zoonotic risk is the horse you are caring for. Next, you can substitute a risky situation by one that is less risky. You may want to look after a horse in a more controlled environment rather than in the field, for example. But this may not always be possible or practical. Engineering controls involve the use of equipment or premises especially designed to minimize exposure to the risk. You can achieve this by putting an animal into quarantine. However, this still requires you to get close to the horse for essential care procedures. You can implement administrative controls by following standard operating procedures and policies that aim to minimize exposures to zoonotic risks. For example, you may have a more stringent patient triage system or use a buddy system to ensure personal biosecurity procedures are followed. The last level of control aims to protect people from direct contact with zoonotic risks and requires the use of personal protective equipment such as gloves, goggles, and masks. Although PPE is considered to be the lowest level of control, in some emergency cases, that is the only thing that will keep you safe from zoonotic risks. The Australian Veterinary Association has made personal biosecurity guidelines available online, which can help you develop your own strategies. If you are unsure about what level of personal protective equipment to use, remember the rule of thumb. If you are conducting a non-invasive procedure on a healthy horse, you should consider wearing gloves, eye or face protection, and a gown or overall. If the horse is healthy, but the procedure is invasive, and you are likely to come into contact with bodily fluids, you should also consider wearing a disposable P2 respirator. If you are dealing with a sick horse, you should consider maximum PPE protection. This also applies if you are dealing with a sick horse displaying Hendra virus-like symptoms and who is not vaccinated against Hendra virus. At the forum held in Scone in June 2021, You further crystallize your own strategies to improve personal biosecurity in the thoroughbred industry. The main strategies you wanted to tackle are: increase awareness about zoonotic risks. We hope this presentation will help you with this goal. Develop or amend your policies and procedures while keeping practices affordable. Provide strong leadership to drive a supportive work culture. Create supportive environments to facilitate personal biosecurity. And encourage a change in PPE usage behaviors. You can protect yourself and others from zoonotic risks by following personal biosecurity guidelines. To sum up, zoonoses are infectious diseases that can be transmitted to humans from wildlife or domestic animals, including horses. Zoonoses present an uncertain risk to humans, as some are yet to emerge, and you should assume the risk is present at all times. Zoonoses can be transmitted from humans to humans and become a public health issue. Zoonoses can make you mildly, severely, or lethally sick, and medical treatments are not always available. But you can protect yourself and others from zoonotic risks by following personal biosecurity recommendations. Your health matters. Don't get caught out. Keep yourself safe from zoonoses.